Federal officials have cleared the way for more health insurance policies that do not comply with the Affordable Care Act.
They do not have to cover prescription drugs, maternity care, or people with pre-existing medical conditions.
KPVI News that works for you reporter Andre Phillips reports.
Promoting healthcare, choice and competition all across.
As promised, the Trump administration ruled on short-term health care plans designed to offer more affordable options than Obamacare.
This is going to be something that millions and millions of people will be signing up for.
On Wednesday, the Department of Health and Human Services ruled that insurance companies can sell policies that are cheaper and offer less coverage than Obamacare.
Generally, they do not cover pre-existing conditions.
Nathan Siemens with the Siemens Financial Group says the short-term plans will likely offer much lower premiums, but insurers wouldn't have to cover the pre-existing conditions or offer the same benefits as required by the Affordable Care Act.
So, for example, an individual who is struggling with cancer, if they purchase this plan after they had already received the diagnosis of cancer, these policies would not be under any obligation to cover those.
Under the new rules, short-term plans can last longer, now up to 12 months, and can be renewed for up to 3 years.
Those who do not qualify for subsidies through the exchanges, either because they don't make enough money. Here in Idaho, we've got that gap population who don't make enough money, or people who make too much money to qualify for those subsidies and that are healthy.
He says the least expensive short-term plan does not cover things like pre-existing conditions, prescription drugs, or maternity care.
If it was not a pre-existing condition, when you purchase the plan, that insurance company would be under obligation to pay all of those claims.
20-somethings with no kids who don't make a lot of money will be offered a cheaper insurance policy, but that comes with a higher out-of-pocket price. A 60-something with higher medical expenses, with fewer young people in the insurance pool, everyone else could pay more. Siemens also says that there are consumer protections that states can regulate the plans, and consumers will be able to decide which plans work best for them.
Scams out there, and so when you find, I would highly recommend finding somebody local, because generally if you go to a broker or an agent that's out there.
The Trump administration says they do not expect the majority of Americans to choose short-term plans, but do expect numbers to rise to over 1 million customers.